Now, there's a ton of surgery going on, too, with back pain. And I always feel, my personal belief, that it should be the last resort, but it seems like sometimes it's not the last resort. When do you find that it's appropriate for surgery as a relief or as a to help eliminate back pain?
Well, if you're sticking with the back pain definition, I would say never. Absolutely never. Now, if I can expand that idea of back pain and say, well, was this subsequent to trauma? Did they fracture their spine in a car accident or something like that? Then is a case to justify spine surgery. Or if they have unrelenting pain down their legs. So it's no longer really back pain, but it's radiating pain. Clearly a nerve root is trapped. All conservative approaches to pain management have been tried and failed. They've lost bowel and bladder control. These are all markers to justify a surgical consult. However, if they've been given the diagnosis of degenerative disc disease and they have more than one level in their back that's involved, so they've got flattened discs at more than one level, back pain is a surgery is a very, very poor choice. They're just rolling the dice now. The chance that a surgeon will be able to go in and cut out their pain when they have multiple levels involved and several sources has been shown to be, well, the surgical disaster. And these are the kinds of patients that I have to deal with.
Right.
But you know what's so interesting about this, Ian, is that statistically, the studies show that those who go in for back surgery for nondescript back pain, while they roll the dice, and some will become very incapacitated afterwards, and some will be quite improved. But after 10 years, everybody's even up. So if they let nature take its course, and better yet, if they understood the cause of their pain and dealt with it through people who understood their movement patterns, addressed the deficits to put their body back into balance and dealt with their back pain that way, generally speaking, they'll do quite well. When I hear, oh, I tried all this conservative therapy, physical therapy, I saw my trainer, etc., and it didn't get better. In fact, it got worse. I would have to say you saw the wrong physical therapist and the wrong trainer. But if you saw the right ones who understood the source of your pain, they could have designed a better program for you.
Right.
Even if they didn't do anything, they're even up after 10 years.
Right. Good.
You know, back pain has a natural history to it. You don't hear of 80-year-olds, as a rule, complaining about back pain. You do occasionally, but generally they complain about other things. But when you talk to them, they'll say, oh, yeah, I had a bad back when I was 30, 40, and 50, but I grew out of it.
Now, that's a good point that you brought up, because in reading Dr. Sorno's book, Healing Back Pain, he talks about the psychosomatic issues with it, and you touch on this in your book, Low Back Disorders. How much of it has to do with emotional factors? I think he was stating that, you know, between 30 and 60, there's a lot of stress and emotional issues. How much of it is psychosomatic? How much is physical?
Well, there's no question that a positive attitude, and that's what Dr. Sarno really promotes. A positive attitude will help. But I will say it absolutely is not the cure. And if the person's pain is real and it's coming from damaged tissue, from repeatedly poor movement patterns or bad lifting patterns or whatever it happens to be, no amount of positive attitude will help that individual. Now let me give you the opposite side of that argument. I've had many patients like this, but I'll give you the example of this one to illustrate. This fellow was a very solid citizen in the community. He wasn't faking his back pain. His doctors, and he saw several, told him, we don't understand your pain. The pain must be in your head. And he was eventually sent to a pain clinic, and their solution was to load him up on narcotics, Demerol and the like, and they had him write down his pain. Oh, is your pain a 6, a 2, an 8? So he could document his pain throughout the day, which was absolutely the wrong thing to do, because he focused on his pain.
Right.
I saw him, and he said, "Doc, I hear you're different, but they tell me the pain is in my head, but it can't be. It's too real. However, if it is in my head, I must be crazy, and I don't deserve to live. And if you can't take my pain away, I'm going to put a bullet in my head." This is a real situation. I've seen them being driven to suicide, being told that the pain is in their head, and all they have to do is take a psychosomatic or a psychophysical kind of approach. The fact of the matter is, when that person is shown motions, postures, and loads, and how to put their body back into balance, and their pain subsides, they're able to have a good night's sleep. They're able to eat well. They're able to tolerate good training activity once again. All of these things will strengthen them again, not only their body, but their mind. A good night's sleep won't rob them of the softness that they get mentally. All of a sudden, they'll be able to handle the rigors and challenges of daily life. But it started by taking their pain away, not by telling them that they have to get used to it.